And after your MPH, you had a role as a program manager at Boston Public Health Commission. Tell us about the work that you did there.
Yeah, I was the Violence Intervention and Prevention Initiative, and I led a youth development program, and I assisted with um, basically communities of practice with the larger entity of the Intervention and Prevention Initiative, where we basically had learning sessions and professional development sessions for our stakeholders. And it was cool to work with the adults who were doing work in capacity building and technical assistance. And because I was leading the youth project or youth program, it was cool because I was able to understand and do some like technical assistance, capacity building from that end of the spectrum. So there was a lot of intergenerational cross collaboration efforts that were done with some projects. We were able to do a violence prevention. We received funding to do a violence prevention initiative, and we did like a stop gun violence campaign. And it was really cool because the young people were on the news, and they were, they created the whole structure and the invitee list and really coordinated those efforts to really address gun violence in Boston. Um, but during that time at the commission, I think that was the most public health agency that I worked for up until that point. And I think that's when again, the depth and breadth of public health, there were the epidemiologists that were working there and the environmentalists. And, you've had those who are in infectious disease. There was like the Infectious Disease Bureau. So there were just so many sectors. And I was in the, um, more of, I want to say it was I can't remember what it was called, but more focused on children, adolescent, and families. Um, and I think something that I really was intentional about, and they were intentional about, was cross collaborative program initiatives, which again just made so much sense to me. And it's something that I uphold to this day, where public health should not be siloed. And even if we have content experts in different spaces or different fields, we can only do the work successfully if we're doing it in an interdisciplinary approach, even, and it should also be with people outside of the field of public health. So I really appreciated that work experience and really getting to understand people who worked there who didn't even have a background in public health, and I thought that was incredibly cool.
And you decided to, I guess, bite the peach and get your doctor of public health in, yes, you can laugh, in community health, behavior, and education, rural health at Georgia Southern University. You alluded earlier that while you were in your MPH program, you had mentors that were trying to connect you with different programs. How did you end up at Georgia Southern University? What was that thought process for you? Yeah, would love to know.
Yeah, and I'm gonna use that bite the peach thing. I like that. The Georgia Southern program for public health is in it's not technically called rural. I think it's called medically underserved. But my program is community health, behavior, and education, and their overarching area of focus is rural health. So again, I found another rural program and decided to go back down. And yeah, this place was a lot more rural. I originally lived outside of the campus, and I just remember my drive to the campus when I first moved here. Again, height of the pandemic. I'm leaving Boston. I moved down here, and like I'm driving and I'm seeing Confederate flags, and I'm seeing farmland, and I'm seeing cotton farms, and I'm like, all right, this is the South. It is the South. Um, but my experience in the program was amazing, and I was able to connect with a lot of very cool individuals who have very cool areas of expertise. Um, but this program was literally hands-on rural health, and again, I was really able to remind myself that humans are going to be humans, and rural humans are still have their own ideologies and cultural beliefs. And if initiatives are to be implemented, my area of research, comprehensive sex education, um there are people who find it important, and I just had to find people who also believed that it was going to be important. And rural health taught me the long game, and sometimes you got to just, plant the seeds and circle back around. And maybe that fifth time around, it might be effective. But again, just a different approach of delivering the same type of concepts. But definitely moving down here was culture shock on many, many different levels.